Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, an anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. This is Ask Dr. Geier Live, the one time, the one place where I answer your questions. If you have ever watched my videos on YouTube and left a question in the comments, even though a lot of times I read those, you'll notice I don't typically respond to those and offer medical advice there. Not that this is ever medical advice, but I don't respond because I save it for these calls. I do sometimes use those questions for future videos, but this is the one place in real time where I can answer your question and give you information about that question related to an injury, to a surgery, to rehab, recovery, a regenerative treatment like peptides or exosomes, PRP, stem cells, that kind of thing. That is what we are here to do. Please note a few things getting started. This is not medical advice. I haven't seen you, I haven't examined you, looked at x-rays, MRIs, anything like that. So nothing I'm saying is medical advice. It is not legal in the United States to give medical advice to people that are not in the state where you have a medical license, and I only have medical licenses in 2 states. So in the other 48 states, I'm not giving you medical advice. This is for general information and educational purposes only. This is to give you more information about an idea so that you can go talk to your doctor and ask about those, information I talk about, maybe make the decision that's best for you, or potentially I'm on the other end of that. You've already seen the doctor and now you're wanting information about what he or she said, so I can fill in the gaps there. Also, if you are watching this on YouTube and you cannot figure out where to leave a question, you leave it in the chat, not in the comments below this video. If you have questions, look for Georgia's chat. Wherever that is, enter your question or comment there. And good to see you, Georgia. Always good to see you on these live shows. I just say that because people want to leave them in the comments, and after every live show I go into YouTube to do some admin work. You have to remember, I'm not on YouTube right now. I'm using a service called Ecamm that sends it to YouTube and to other places, and so I cannot see what's in the comments. After the show, I'll be in there and see 3 or 4 questions left in there that I never got to see. So if you have questions, leave them in the chat. That is the only place that I can see them and get through to them, get them up here, post them on the screen, and address them. I stay as long as there's questions. So I will do 20, 25 minutes, or I'll do 5 minutes, depending on how many people are there. Hal Barton says hello. That is good to see you. Daniel Flynn, love your videos. I very much appreciate that. So I'm going to start at the top and work down, and we will go from there. The shorter the questions, the better, because nobody wants to see me read long things, so I don't typically do that. So short, like these that you'll see here in a minute. Beauty Mistress, fractured finger a couple years ago, didn't get it properly fixed. Now it's bent over the tip, cannot be repaired without an operation. Again, this is hard because I haven't seen and examined you and looked at x-rays, but what that sounds like is a mallet finger. Now it can be a fracture, or it can just be where the extensor tendon gets pulled off the end of the bone, the distal phalanx. What happens a lot of times in sports, like a ball will hit you on the tip of the thumb and force it down, pulling that tendon off, but sometimes you can pull a piece of bone off. If you leave it alone and you don't fix it either surgically or hold it in place with a splint that keeps the finger extended, it tends to heal with your finger down like that. And once it heals that way, it is almost impossible with any amount of rehab to get that straight again. And so yes, a lot of times that involves a surgery, and even that is tricky. So ideally, again, I don't know if this is a mallet finger, that's just what that sounds like. That is something you'd be much better dealing with properly the first time than down the road. Even with proper treatment, sometimes that can happen, just way less likely. If it's some other injury, then yeah, you have to deal with the ramifications of a finger that won't fully straighten, and that can be a tricky problem for sure. Georgia says, where'd we go? There we are. My daughter's going to have arthroscopic knee surgery for a possible torn meniscus. How will recovery be? I hate to hear that. I know that is never fun for anybody, let alone a son or daughter. I definitely get that. What I'll say is with the meniscus tear, so the arthroscopic surgery by and large it revolutionized medicine. I have a whole chapter about meniscus surgery for Joan Benoit back in the early 1980s, the first U.S. women's marathon runner in the Olympic 94 or 84 Olympics, and how she went through meniscus surgery. What was it, 17 days before the Olympic trial, something like that. It really depends. So I mean, it's way better than the big long open surgeries that you saw from the 1970s. What I will say with the recovery from meniscus tear surgery is it very much depends on what the surgery is. And by that I mean, is it where they go in, sew the meniscus back together with stitches or anchors, or is it trimming part of the meniscus out? And a lot of patients probably mistakenly assume that it's a meniscus repair. Only a small percentage of meniscus tears can be repaired. It's probably 15 to 20% of meniscus tears are repairable. It's based on the orientation of the tear. Typically younger people, like I imagine Georgia's daughter, are probably in that group. Once you hit about age 40, it's typically you're much more likely to have a partial meniscectomy because older adults typically get different type of meniscus tears. But having said that, the recovery would be greatly different. If you're just trimming it out, most people are back to most of their normal activities by 6 weeks or so. A lot of people even playing sports within about 6 weeks. Full recovery is probably more like 3 to 4 months, but again, you're putting full weight on it right away. You're doing a lot right away. If it's a repair, it's a much longer process. You're talking about probably being on crutches for a period of time, sometimes up to about 4 weeks, being in a brace that limits motion for up to maybe 4, sometimes 6 weeks. Certainly no running or sports for many months. Running maybe 3 or 4 months, sports a lot of times 6 months or longer, because you want to protect that repair while it's healing. Those repairs are very tenuous until the body heals the meniscus back to the way it's going to be. And so you a lot of times limit knee flexion and certainly limit impact. And so it really depends on what that is. It's going to be one of those two, and then those would be generally the recovery timelines for both of those. Daniel says, tell you what, Daniel, I do VA. I should have said this at the beginning. VA, that's a whole different show. And so I will be on the other channel, Veteran Nexus Letters with Dr. David Geier, at 5:30, and I will answer that. So ask me that then. I try to keep the two shows separate. Now, if you want to know what tibial sesamoiditis is, I can explain that, but I don't do discussion. I don't want to bore people with other issues here. I have a whole separate show for veterans. Georgia says, thank you. Daniel, short-term tibial, or for people that don't know, sesamoiditis are the small little bones under the ball of your foot, the first MTP joint, metatarsal phalangeal joint, and you can have fractures of those bones, or you can have sort of an inflammation or sort of almost like a stress reaction of those, and that's what a sesamoiditis is. Very tricky problem from an orthopedic standpoint, actually. You do what you can to get it to heal without surgery. Usually that's limiting any kind of weight on it with like a walking boot, sometimes a cast. It depends on exactly what it is and what the demands of that person are. But sometimes that doesn't work, and then you have to decide surgery and what that surgery potentially entails. It can be tricky, and diagnosis is tricky because there is a lot of different things in that small area on the bottom of the ball of your foot that can cause pain there. So even an MRI sometimes can be a little misleading as trying to identify the exact source of pain. So it can be a tricky problem. In orthopedics, we tend to defer those out, even though I saw a lot of that in sports medicine. A lot of times the orthopedic foot and ankle surgeons dealt with that because, again, it can be in a lot of people something that really becomes a tricky thing to treat. But as far as the VA claim, Daniel, just I'm on that show at 5:30, and I'm happy. Just send that again because this doesn't carry over. It's a completely different YouTube channel, so I won't be able to move the comment over, but I am happy to do that. That looks like all of the questions that people are submitting for Ask Dr. Geier Live. I will be on here again February 2nd. That's Monday, February 2nd at 5 p.m. Ask all your questions, and by all means, in the comments under the videos, feel free to ask questions. Again, I get my ideas for videos for this channel from those questions, so definitely do that. I just can't respond with medical advice in the comments there. I do it with the disclaimers given on this show. So very much appreciate it. If you are a military veteran and you came to this just for fun, or you didn't know, join me at 5:30. There should be a link that you would have gotten on the if you subscribe to my email list. If you don't, just go into YouTube, search Veteran Nexus Letters, Dr. David Geier. You'll find the channel, and then there'll be a link there. Also, if you are potentially interested in seeing me as a patient, unrelated to disability claims, but just as a patient wanting options other than surgery, physical therapy, cortisone shots, things like that, you want to talk about different regenerative treatments, I am happy to help. Go to in the link below this video in the description, there will be a link that takes you to my website's contact page. Just click the schedule an appointment, fill in all your information about the potential type of injury. I will respond to you, and we can talk about if doing a Zoom call to discuss options with me would be appropriate. There's also a link to an ebook there that I've written. It's called The Arthritis Solution, but it pertains to way more than arthritis, about all different kinds of integrative and regenerative treatment options for all kinds of orthopedic injuries. So check that out. You can get that completely free. Very, very much appreciate everybody being here. I hope this, as always, is helpful, and I will see you all very soon. Take care.